right? So we've been thinking about what the hospital of the future might look like and how technology can enable that future of healthcare. We have a marketing background, as you know, same as you, and we've taken what we've learned with consumer marketing and customer experience, and we've applied that into the healthcare sector for what we call patient experience. And as you know, this year there's the emergence of a new term called total experience, which also takes into consideration things like how employees are feeling. And, for example, if someone's having a bad day, if an employee is having a bad day, then the level of care they're going to be delivering to a patient is going to be affected. Or similarly, if they're spending a huge amount of time on paperwork or asset tracking or logging hours or things on paper, or using paper forms to onboard people, then they're not going to be feeling as good about themselves as if that was somehow made more seamless through technology and therefore delivering a patient experience. So we've been thinking in the last week or so about a concept of the hospital of the future having to be very patient-centric, similar to what we were talking about with Martin around customer experience a few weeks ago. So yeah, we've been thinking about what the hospital of the future looks like, and we've been thinking that actually the hospital of the future has to consider what the patient of the future looks like. And I think this is potentially one of the places where Web3, or at least blockchain technology and new digital technology, might be able to redeem itself slightly and provide some real utility to real people rather than just being used to play games and flog tokens. So some of our thinking, we've been thinking about different types of patient personas, and all of this came out of the pandemic. So we've identified a series of patient personas, and the first one, which is really quite interesting, is what we call the digitally native patient. The Facebook generation are in their 40s.
Wow, you know what? That's crazy to think about, isn't it?
Yeah, the Facebook generation is in their 40s. So since 2005, patients have been able to inform themselves about healthcare and wellness via YouTube. Since 2010, over 116 million Fitbit devices have been sold. And the thing that's happening in healthcare, which we're finding, is that patients are a bit like B2B customers when it comes to e-commerce. They spend their lives in seamless UX experiences, onboarding from neobanks and Amazon's one-click checkout, and all of these things that they've been conditioned to accept when it comes to why things, can be really, really easy on an app. So why do I have to, when I walk into my local clinic or my local hospital, why did they give me a clipboard with 6 pages of paper that I have to write my information on in a pen? And so
right. No, that's true.
Consumers who are used to apps are saying, hang on, this doesn't make any sense. We're in 2022. Why does Amazon give me a certain experience? Why does Airbnb give me a certain experience? Why does Uber give me a certain experience? All of which are pretty decent. But every time I walk into a new hospital or a new healthcare provider, I have to sit in a chair, fill out a form in order to provide my details. So So we've identified what we call these digitally native patients that expect the same level of experience from their healthcare providers as they do from Amazon or Instagram. They want it to be intuitive. They want it to be seamless. They want it to be enabled by technology. They expect to be able to interact via WhatsApp. I mean, that's the other thing that we've found in consumer marketing. If you tell me that I have to call you between certain hours, then I'll go somewhere else. If you tell me that you provide 24/7 WhatsApp support, I'll go to the company that provides me 24/7 WhatsApp support over the company that tells me I've got to ring them between 12 and 5 on a Wednesday.
Right.
So why should healthcare providers or hospitals be any different? Consumers are expecting that, if they want to interact via WhatsApp, they should be able to interact via WhatsApp. If they want to interact via VoIP or Zoom, they should be able to interact by VoIP or Zoom. If they want to do a consultation remotely via a chat app, then they should be able to. So But there's obviously some threats to hospitals that don't take these people seriously. And we're talking about disruption. If you just go on building your hospital or your healthcare provider out into the future without considering the way patient behavior is changing, then you open yourself up to threats from hospitals and providers that do take these issues seriously. The second one, which was emerging before pandemic, and I think will come back, is this idea of globally mobile patients. Healthcare tourism before the pandemic was huge, growing really quickly, 20 to 30% per annum. These people who have got enough money and enough mobility to be able to say, you know what, if my local hospital won't provide me this service, I'll fly halfway around the world and get it done somewhere else, whether that's Dubai or Switzerland or Australia or South America. I will identify the best provider in the world. I will fly there. I will have my treatment. I will recuperate in a 5-star hotel, next to that provider, and I will fly back when I'm healthy again.
Right.
On the one hand, you've got globally mobile patients who have the means to be able to literally fly out of the local market and into a different market to have their treatment. And on the other hand, you've got telehealth, which means that, as you were saying before, you don't have to recruit a doctor from within a 15-mile radius anymore. You can recruit a doctor in Hyderabad. If he can deliver his assessments and his consultations via a telehealth solution, then you suddenly are opening yourself up to a global talent pool of healthcare providers. We see that as a trend, globally mobile patients. And then the last one, which is really interesting, and I think this applies to women more than men, perhaps, is that you've got a group of patients who are suddenly incredibly well informed about their health. They've got access to information that they didn't have before, whether that's coming from YouTube, whether it's coming from research centers that are publishing their information directly, whether that's coming from healthcare providers like Cleveland Clinic that have got their own YouTube channels that are allowing patients to inform themselves to an incredible level, which, again, provides opportunities and threats. And then once you've thought about the patients, you can then start thinking about the technology, the digital solutions, rather than sort of saying, hey, we've got blockchain, how do we apply it to healthcare? Does that ring true? Because I know you've been in the insurance business, recently. Do those trends kind of ring true from your experience?
Oh, absolutely. Absolutely. The question that I have first is, are you finding a lot of healthcare companies actually interested in hearing about this?
It depends on the region and it depends on the situation. So there's a difference between public and private. There's a difference between percentage share of public versus private in a certain market. There's a difference depending on the insurance market within a particular market and how insurance companies become part of the process. So we were speaking to a healthcare provider in the Middle East, and they were saying that the biggest pain point they've got is insurance companies. So there's a whole bunch of different journeys that need to be mapped. But
sure.
We're talking at a macro level. So what I do know is that there are certain brands. I mean, these are places like Cleveland Clinic or Mayo Clinic or Moorfields Eye Hospital in London. They're now becoming almost global franchises. But they're going off their trusted name in their initial local market, and they do have patient experience strategies, patient charters, and patient experience leaders. Some even have patient experience champions at a C-level. There are some healthcare providers and some hospitals that I've identified that patient experience is a differentiator against some of their competition.
My professional curiosity, I'd love to work with some healthcare concerns, like some hospital groups, to learn more about like where they're at in this kind of customer experience, patient experience journey, and understand where their head's at from a standpoint of working with Aflac, which I'm sure everybody by now knows I've worked with in the past. And I can't speak for other insurance providers, but I have to expect that there's plenty of other ones that are thinking the same way. Like they were super forward thinking about, and we did a lot of this in the innovation team in Hatch. So, we were looking at developing technologies that would like be able to tell, like if you had, for instance, one of the things that we had talked about is if you had the My Aflac app on your phone and you had it turned on where you gave it permissions to, and it realized that you were at the hospital or at your doctor's office, because it would know what doctors were yours, obviously, because we have that information. It would know that you were there, and it would say, hey, we see you're at the hospital. We see you're at the doctor's office. Does an event happen? Would you like to file a claim? Or would you like to be, like they would get out in front of it and proactively ask you or file the claim for you? Because for us, we were trying to figure out ways that we could reduce the friction of having to provide, like we were looking at ways to tap into your electronic medical records so you wouldn't even have to file a proof of loss anymore. Do you want us to file a claim for you? If you click yes, we could just go out, pull your electronic medical records and automatically file the claim. And all you'd have to do is hit yes. Like just trying to make it easy for the doctors and for our policyholders and try to ease that experience end to end. We haven't gotten to the place yet where healthcare providers, the electronic medical record companies that live in between, like Epic and all of those, and insurance companies have learned how to communicate and talk and work hand in glove yet. I think that we're slowly moving towards that.
And this is where you come back to patient centricity. So are the insurance companies being run by bean counters? Are the actuaries and the bean counters running the show? Or are they thinking about, actually, if we provide the better experience for our patients and our customers, then they'll be more loyal? That comes onto the second part of it, which is the total experience part.
That's right.
And so you've got your patient, that's one thing, and there's a whole bunch of challenges and threats and opportunities around patients. Then you've got your employees, and it's a challenging environment. A lot of healthcare organizations were originally built around doctors, and doctors spend a lot of time and money going to medical school and have had a position of respect in the community traditionally, and also have within the organization are respected. I think that's changed, especially within private healthcare. Perhaps the money men, the commercial teams and the administrators have gained a bit more power within the organization, and doctors have been sidelined and healthcare professionals have perhaps been sidelined in favor of the shareholders, which isn't necessarily a great thing. That has an impact on the patient care.
Yeah, we spent a lot of time talking to doctors, and of course they're super, yes, please help us do this. My experience has taught me there's nobody in the equation that is actively working against the model. It's just that everybody works in a vacuum, right?
Right. Silos. We've mentioned total experience before, which I think is something that Gartner's trying to push this year as a sort of a buzzword.
Right.
But they're talking about total experience within a consumer and retail sense. They're not necessarily talking about it within a healthcare sense. In a healthcare sense, it makes a big difference. That leads into the technology part. That's where it starts to get interesting. How do we use something like IoT, which is being used extensively within hospitals and healthcare now, whether that be from cold storage chains to make sure that drugs have been kept at the right temperature. It might be machine learning or AI for diagnosis. We were talking about virtual beings in our last podcast, and I can imagine that virtual doctors, certainly from a GP kind of sense, you could probably replace a GP with an AI. I'm sure there'd be hundreds of doctors shocked to hear that, but at the end of the day, all they're doing is triaging a certain amount of information and saying, okay, well, tell me your symptoms, and they're thinking, well, from my experience, this is what I think those 5 symptoms equal. An AI can do that just as easily, right?
Right. Like, how is that any different than the doc in the box that we have here at all of the pharmacies like Walgreens and CVS? They have a little minute clinic.
Well, no, exactly. So if you take your temperature and you do a little, maybe even a blood test or pinprick blood test, and you submit that, and or you're wearing a wearable, which is a glucose monitor or something else, then there could be a whole bunch of remote diagnostics going on. And an AI could determine at least a short list of things that might be wrong with you, the same way a doctor would. And perhaps that's an opportunity from an efficiency point of view, that the doctors are kept for things that are really, really serious or really require their expert knowledge.
Their attention, right.
Obviously, then there's mixed reality. We've talked about on the podcast in passing VR for pain management. So maybe there's personalization, which I know you've looked into, that not every patient is the same. So a woman of childbearing age is treated differently to a smoker who's smoked for 40 years.
I mean, there's just so many possibilities. I think that healthcare has so much opportunity in it for improvement in the experience realm across the board in every corner of the hospital.
It's a fascinating thing. We're going to spend a lot more time on it. Like I said, the white paper will be out relatively shortly, and we've got some other cool stuff that we're working on. I read something this afternoon by a company called Spatial, who I've mentioned on the podcast before, who creates soundscapes. They've created soundscapes for healthcare workers in their break rooms to help them relax and provide cool soundscape spaces, which is pretty interesting stuff. So
much interesting stuff, though. I'm really fascinated by the work that you're doing in the healthcare space. Just because I haven't really, I've worked in insurance, which is connected, obviously, but it's not the same. You know what I mean?
It's part of the value chain, though, and it's part of the journey. It's
part of the value
part of the journey, and an important part of the experience, especially in America, I imagine, where insurance is such a huge part of the experience and value chain. We've identified some specific threats to healthcare organizations that don't take some of these trends seriously, but there's also some huge opportunities for the healthcare providers that can see these trends and use technology in a smart way to differentiate themselves